How can mental health resources become more accessible? We asked 208 family caregivers in the state of Utah about what barriers they have observed in helping their family member with an intellectual or developmental disability, also called IDD, access mental health care. Through analyzing these caregivers' responses, we identified 6 major barriers that families face. The number one challenge that caregivers listed was a lack of resources. This included challenges such as a lack of qualified or specialized providers, long wait lists, a lack of transportation, or a general lack of knowledge about mental health care and how to access it. We got responses such as, "My son has been on the list for over 15 years," and "We felt very alone on our quest for help." Another major barrier was inconsistent care. Families experienced high rates of staff turnover, being moved from one provider to another without receiving care, and being aged out of programs or funding. One family caregiver said, "Our agency provider has changed several times in the past year, and the current therapist just left the agency, so we are in need again of a new provider." Family caregivers also highlighted insurance issues as a barrier to care. High copays, restricted provider networks, and limits on the amount of care covered were common struggles that families faced. A caregiver said, "Finding a mental health provider who takes our insurance is a challenge. Private insurance won't even pay for weekly visits through half the year." Many families reported communication challenges occurring between providers, caregivers to providers, patients to providers, or patients to caregivers. Unsuccessful communication between parties inhibited the ability for high-quality mental health care to be given and received. One example of this was a response stating, "We were told we would receive help with resources and assistance in applying for resources, but then had no follow-up or responses to communications." Finally, family caregivers described struggles balancing personal or family responsibilities with caring for the individual with IDD. This included caring for other children, the physical or mental health needs of the caregiver, employment, or other financial and time constraints. One caregiver's response said, "We have more than one special needs child, and my husband and I are both working full-time to afford living expenses and health insurance." However, a few families reported positive experiences with accessing mental health care for their family member with IDD. These caregivers shared examples of providers or programs that met or exceeded their expectations for care and resulted in a positive impact on the individual with IDD and family caregivers. One participant said, "My provider learned how my son communicated and helped my son express his emotional struggles." So, what steps can we take to mitigate these barriers? Policy adjustments can be made to improve disability support services and insurance accessibility. Systemic changes among programs, funding, and supports for caregivers would be immensely helpful. More education for the public on both IDD and available resources can be made accessible through websites, contact lists, public displays, and social media. Additional training for providers to work with individuals with IDD through specific courses and degree-seeking programs and professional development would help increase accessibility to mental health services for all. Visit Utah State University's Center for Mental Health Promotion website for more information about this project.